And here we have Beck and Ginny. Ginny's doing the belly mapping with Beck, who's come to the Spinning Babies workshop to be the volunteer, so that some of our practitioners can do some demonstrations and some practicing of the techniques that Ginny has been teaching this morning. So Beck, coming here today, what have you actually gotten out of being the volunteer for us?
It's been really good to figure out for myself the baby's positionings, and also just to learn a few techniques to make me a little bit more comfortable in these final few days or possibly weeks before I give birth.
Okay, and what did we actually do with you today?
Today we did
so did the balancing techniques during pregnancy, the exercises that will help you have an easier labour and to create space for your baby to go through. How did that feel?
That was really good. Laying on the bed, getting the diaphragm stretch was really nice. And
was that your favourite?
Yeah, and the glute massage was really good as well for my sciatica pains, which was nice.
So you've actually found that that's given you a lot of relief now since doing that?
Yeah, I actually feel a lot taller, which is good. I feel like I got a bit more space in there, which is nice.
Good, excellent. And with doing those techniques, do you think that they could have helped you even more if you were doing that a bit earlier in your pregnancy? Yeah,
definitely. I think, especially because I'm having a summer baby, it would have been good to start a bit earlier to just get a bit more relief in the warmer months. But it definitely does help, and it would have been fantastic having to start it a bit earlier, maybe in the second trimester, and knowing those techniques to do at home, and or having a practitioner consult with me a bit more frequently would have been great to have.
Good.
Yeah.
Good. And what do you recommend, Ginny, from this point on for Beck before her birth?
Definitely to get your partner to learn the exercises so you can practice it every day. It doesn't just bring relief during the pregnancy, but it's going to help during the birth as well, and ultimately is to really have a fast and a much easier and smoother birth experience.
Yep.
So learning how to use it now prepares you for it, and then during labour and birth when needed, it's also a relief.
Yeah, definitely. It's definitely something that I can see my husband and I doing while we're in labour, especially doing a VBAC this time around. It's good to have some strategies that we can implement together and get labour going as smoothly as possible.
Great. Okay, and so Ginny, what do you want to say to someone who would like to come to the next Spinning Babies workshop?
Be ready to learn a lot, have fun whilst you're learning it, and it's really gonna change the way you think about the whole pregnancy and birth process, and it gives you really concrete tools that you can use to work with people, whether you work with them during pregnancy or you work with them during the birth. Yeah.
Good. Great. And I think today we've had quite a high number of midwives that have attended the workshop today. So it's great to see that those midwives are getting a different point of view and now going to have tools and techniques to help, you know, their pregnant women who are coming for their antenatal appointments, but also during labour as well. And it's not just about, you know, what the cervix is doing. It's about asking, where is baby?
Definitely.
Yeah.
Yeah.
Definitely.
Okay, thanks Beck. Thanks Ginny.
Thank you.
Okay, bye-bye.